Feeding Video 3: Ways to Help Babies Eat. If you haven't already, please watch Feeding Video 1, an introduction to infant feeding. In the last video, we listed a number of different ways you could help babies facing different feeding problems. In this video, we're going to go into detail about how to do these different techniques and strategies. First, preparing the baby to eat. Some babies are ready to eat with no preparation at all, but other babies do benefit from a simple warm-up. First, bundle or shoulder bundle the baby and hold him or her in the position you will to feed. Once you and the baby are settled in the feeding position, give the baby an opportunity for non-nutritive suck, such as on a soother. Sucking on a soother or a clean finger gives a baby a chance to warm up his or her sucking muscles before needing to add in the hard work of managing the flow of milk. Do you see how much more focused and alert this baby has gotten, and how much more rhythmical her sucking bursts are? She's now in a much better state to manage the work of eating. External support means supporting the baby's body so he or she can focus on eating and not waste energy trying to keep his or her body organized. There's a number of ways to do this. When bottle feeding, we often recommend bundling before feeding. Bundling helps keep their bodies organized and feeling secure so they can focus all their attention on eating. Fully bundling the baby, like this, provides the fullest feeling of support. We recommend folding the baby's arms over the chest so the hands are together. The bundle should not force the baby's hips straight, but simply provide a lower surface for the baby's legs to push against when they move. If it seems too warm, you can undress the baby down to his or her diaper before bundling, or use a lighter material blanket to bundle, or use shoulder bundling. Shoulder bundling provides support and positioning to the arms and shoulders while leaving the legs free. For babies who only need a little help with staying organized, this can be enough. Another way to provide support, especially when breastfeeding, is to use your body and arms with or without the support of pillows. When breastfeeding, your body and arms provide a lot of that same support and external gentle pressure, so bundling is usually not needed. Remember to support your arms with pillows or armrests as you need to, so you don't end up with a repetitive strain injury. Talk to your public health nurse, lactation consultant, or occupational therapist if you need advice about supporting your infant during breastfeeding. Positioning to control the flow is helpful for many babies with stressed or immature nervous systems. There are two positions that are commonly recommended: upright and side-lying. Upright positioning is just what it sounds like. The baby is held at a fairly upright angle, usually 45 degrees or higher, for the entire feed. Bundling the baby first can help a lot with keeping him or her upright. This upright position can help to give the baby more control over the flow of milk. When a baby is lying flat, the milk runs down to the back of his or her throat immediately. When he or she is upright, the tongue and cheeks need to do more work to move the milk back, so the swallowing mechanism gets more warning and the baby is less likely to make a swallowing mistake. Side-lying position. More and more often, occupational therapists working with newborns with feeding problems are recommending a side-lying position to help babies eat in a safe and organized way. We find that side-lying provides the most controlled flow of milk through the baby's mouth towards the swallowing mechanism. This position can be hard for the adult feeding to get used to, as we're used to bottle feeding babies on their backs looking up at us. Here are some tips that can help. If you're going to feed a baby in side-lying, bundle him or her first. This will make the baby easier to position. While you're feeding, use a pillow to support your hand and wrist, especially if the baby is bigger. You don't want to end up with a repetitive strain injury to your hand, wrist, or arm. Once you and the baby are positioned, feed as you would normally, using whatever techniques help your baby. In the most traditional way of feeding a baby, breastfeeding, the baby's often positioned in side-lying. If you're breastfeeding and think the rate of flow of your milk or the feeding positioning is affecting your baby's eating, please speak to your public health nurse, lactation consultant, or other breastfeeding support person for strategies that can help. If the baby is bottle feeding and is not pacing him or herself, that is, taking enough breaks, then you, the feeder, need to give the baby those breaks. We call this external pacing. After every certain number of sucks, you take the bottle out of his or her mouth or tip it down so that the baby is sucking on air instead of milk. This gives the baby a chance to catch his or her breath. The frequency, how often a baby needs this pacing, will depend on the baby. Between 4 and 6 sucks is common. If your baby needed this kind of help at discharge from hospital, you'll hopefully have a written home program telling you details specific to your baby, as well as the name of an OT or other feeding specialist to get in touch with for follow-up. If your baby starts to need this kind of help and has not been assessed by an occupational therapist or other feeding specialist, please speak to your healthcare provider and ask for a referral. If you're breastfeeding and have questions about your baby's pacing during the feed, please speak to your public health nurse, lactation consultant, or other healthcare provider. Many babies with feeding problems need a very calm, quiet environment in order to eat their best. Because eating is a complicated job that takes a lot of timing and coordination, it makes sense that a distracting environment, an environment that makes you pay attention to it instead of to what you're supposed to be doing, will make it harder for some babies to do the job of eating. Please watch the video, A Practical Guide to Controlling Your Baby's Environment, for ideas on how to use the environment to help your baby. Timing the feeds is also important. Basically, this means learning your baby's cues. Every baby is different and will give different signals about when they're ready to eat. When you try to feed babies before they're ready, they can be sleepy or just not interested and won't eat their best. On the other hand, if you miss your baby's hunger cues and wait too long to try to feed, it may be difficult to get the baby settled enough to eat. This can be especially true for babies who have extra trouble staying or getting calm. Common signs that a baby is ready to eat include rooting or sucking enthusiastically on their hands or a soother or your finger, and beginning to get fussy, especially when also rooting or trying to suck. Every baby is different, and babies themselves are constantly growing and changing. How does the baby you're caring for show when he or she is hungry? Is it the same every day, or does it change? Even when you know a baby's hunger cues, there are going to be times you don't catch a baby at that perfectly ready-to-eat moment. If a baby has gotten over hungry, you may find you have to use other strategies for that feed, such as preparing the baby to eat, external support, or controlling the environment, even if you normally don't need to. Bottle and nipple choice can make a real difference for some bottle-fed babies. Whenever possible, breastfeeding is recommended for all babies, but there are many reasons why a baby may need to bottle feed either sometimes or all the time. Some babies who had trouble feeding while in the nursery will go home with a particular bottle that was recommended for them. In those cases, we recommend you continue using that bottle. Follow up with the feeding specialist if you have questions, concerns, or feel the baby is ready to change to a different bottle. In terms of nipple choice, there are two main differences: shape of nipple and the speed that it flows at, or flow rate. There are lots of different bottles available with lots of different shapes of nipples. For babies who are breastfeeding and using bottles, a bottle with a wide-based nipple is often chosen, as it encourages the baby to open the mouth and lips wide the way they need to for breastfeeding. Other than that, a lot of nipple and bottle choice comes down to family preference or habit. If a baby has started eating well using one bottle or nipple, especially a baby who has had trouble eating, we do suggest you stay with that bottle or nipple until things are going really well, as changes can be stressful and some babies can find it hard to change and adjust. In terms of safety, knowing the flow rate of a nipple is very important, more important than the shape. The flow rate means how fast the milk flows out of the nipple. You can check how fast a nipple flows by running water through it. A nipple that flows too fast can overwhelm an infant and cause him or her to make a swallowing mistake or refuse to eat. A nipple that flows too slow can mean a baby needs to work harder and burn more calories to get the milk out of the bottle. Generally speaking, for most newborns and young infants, you want to buy nipples that are marked newborn or slow flow. Unfortunately, every brand of nipple is a little different in terms of how fast or slow it is, and once the nipple is out of the package, they all look pretty similar. Most nipples have an indication of the speed on the rim or the side of the nipple, though it can be hard to see. If your baby's suddenly overwhelmed by the flow from a nipple, it may be that the nipple has gotten stretched or cracked and is flowing faster than it used to. Or, if you have more than one baby in the house, you may have accidentally switched out the newborn's nipple for an older baby's faster nipple. When in doubt, check the nipple out. All nipples can stretch over time and may develop cracks. You should check them regularly and replace as needed.